double check your name here. So could you just verify your name and birth date for me? So that's Dennis York, 03/05/2006. I just wanted to let you know, I know that you're in pain and we've done an assessment, so I'm going to give you some morphine and some dihydrogenate for that. I just want to do a pain assessment, so I'm going to do a PQRSTU on your pain. I'm also going to take a set of vitals, and particularly looking at blood pressure and respirations, because that's what morphine affects the most. And I'll also be looking at your nausea. So are you feeling nauseous? And also just if you've had any bowel movements, if you're feeling like you're feeling dried out, because dihydrogenate can also cause you to dry out. So I'm just going to make sure this dose is safe, and I'm going to go drop the medication, and then I'll come back. Do you have any questions for me? Okay, great. So I'm just going to do this. There. Okay. Alright. So now I'm going to see if this dose is safe. I'm going to find here, I'm looking if it's compatible in the same syringe. So right here in the drug, or in this monograph, I can see that morphine is compatible in the same syringe with dihydrogenate, and it would say the same in this one as well. So for dihydrogenate, we have 5 milligrams. 5 milligrams per kilogram per day. It's dihydrogenate. And then we have morphine. Pediatric dose, age 1 to 12 months, greater than 1 year. So, morphine is 50 to 100 micrograms per kilogram per dose. Q 3 to 4 hours. Okay, so now that I've checked that, I'm going to do my math. So the supply is 10 milligrams per mil and 50 milligrams per milliliter of dihydrogenate. First I'm going to do the weight. So he's 75 pounds. I'm going to divide that by 2.2 to get that in kilograms. So 75 divided by 2.2. So 34.1 kilograms is what he weighs. If we look here, it's 3 milligrams IM Q4H of morphine, PRN, so yeah, we're doing 4 hours. So we're going to take the weight, and we're going to go for the low first. That would be 34.1 kilograms times
ask if they're having any issues coming along with their wound. So, and then I obviously would
50 micrograms.
To ensure privacy. I would only expose the area that needs to be exposed to this as well. I would assess the need for anesthesia as well to see if it's
4.5.
go ahead with this.
So
this procedure.
that's micrograms. I'm going to convert that to milligrams, put 3 to the left, so it's 1.7 milligrams per dose. So just to verify that, 50 divided by 1,000.
Most importantly with this is trying to maintain sterile technique, so
Yeah, okay. And the high dose for the morphine, equals, so we're going to go 34.1 kilograms times, and then the high dose is the 100 micrograms. So 34.1 times 100 micrograms. And so to divide that by 1,000, moving 1, 2, 3, so the max dose is 3.4 milligrams per dose. If I look here, the dose that's been prescribed is 3 milligrams, so the morphine is safe. Okay, and then we're going to do the dimenhydrinate.
The first thing that I'm going to do is, again, assess for pain and make sure that this is going to be a simple a smooth process. I'll remove the
At the beginning of the video, I should have stopped and washed my hands before I went into the patient's room, but I didn't do that, so that's something I should have remembered. Just continuing with this, 34.1 kilograms times, so the dimenhydrinate dose, just to check here, dimenhydrinate, pediatric 5 milligrams per kilograms per day, so I have that there, times, so there's no range here, so I'm going to go times 5 milligrams, and that's going to give me the daily dose, so 34.1 times 5, so 170.5 milligrams per day.
Position the client in a comfortable way.
So just looking here, dimenhydrinate Q6H. Yeah, so every 6 hours. So if I go every 6 hours, 24 divided by 6. So it'd be 4 doses per day. So we have 4 doses per day. So we'll divide this by 4. We'll go 170.5 divided by 4. So per dose, 42.6 milligrams per dose. So looking at these calculations, this dose is safe because the dimenhydrinate is less than 42 and the morphine is 3 milligrams, which is between 1.7 and 3.4. What volumes will I draw up of each medication? So we have supply is morphine, supply is 10 milligrams per milliliter. Alright, so that's supply, and then the order. The order is 3 milligrams. So we're going to go 3 milligrams divided by 10 milligrams times 1 milliliter. 3 divided by 10 times 1, so we're going to have 0.3 milliliters of morphine to draw up, and then for dimenhydrinate, the supply is, let's see here, 50 milligrams per milliliter, and the order is 40 milligrams. So we're going to go 40 milligrams
that will be under the
over
ban,
50
not
milligrams.
anywhere
And that
outside.
is in a 1
So the
milliliter,
next
so
pass
times
will
1
be on one
milliliter
side,
equals
and then discard
40
it again.
divided by 50 times 1. So we're going to be drawing up 0.8 milliliters. This means that I'm going to need to grab supplies and a syringe that's bigger than 1 mil.
This is on the other side, all the same direction there, and I would continue that process with as many pieces of gauze that was necessary to make sure that the entire area
All
has
right. So now taking the MAR,
that will be covered by the dressing.
the physician's orders and the MAR, I'm going to get my supplies. So just checking quickly that these are the same, comparing. They are for Dennis York. Okay. So I'm going to grab my supplies now.
The next thing that I need is the dressing itself. Okay, so now that I have the dressing, there's an obstacle course to get back in here. And I'll make sure that privacy is maintained, but this isn't maintained. So, now I've got the appropriate dressing and extra gauze now that's necessary. The next thing I would do is evaluate the wound completely. I would measure it. Well, since it's a surgical wound, you don't really have to document every aspect of it, like you would just like an abrasion or a trauma-related wound, because the edges of it are so defined and often well maintained that it's not as much of an issue. So, next part, and make sure not to come into contact with the actual sterile field, which is the white part there. And when applying it, I'll also make sure that this the peel-off covering doesn't touch the wound either, because that is not sterile. Through all of this, I'm making sure that the client's comfortable and that they're aware of everything that's happening, and that they have a say whether to keep going or stay, slow down, or ask them how it's feeling. So now the sterile field is reapplied. The sterile dressing is reapplied and it's changed. I would ask the client if they need anything else, if they need any analgesia to help alleviate any pain that may have been caused because of the dressing change itself. And again, I would check their body positioning and see if they need any help or assistance in moving them, rolling them over, and finding a comfortable place for them to lay down for recovery. So, I believe that would be the end of the dressing change itself. And yeah, so that is the end of it. And then ultimately, well, that is the end of this piece. And then now, documentation becomes the part. just stop the video then.
Alright, I'm back. So, normally I would do this in the med room, but I'm going to do my first check here. So with the MAR beside me and the medication, I'm going to check if I have the right medication. So checking, I have morphine, so right drug. I have 10 milligrams per milliliter, so that is the right concentration that I've done my calculations with. I'm going to be giving 3 milligrams. I'm going to be giving it IM, and that's the right route, so I have the ampule. I'm going to be giving it now because this patient is in pain, so there's the time and the reason. And then I'm giving it to Dennis York, so the right patient. And I'll be completing my documentation at the end once I've given the medication. Now I'm going to look at the diamond hydronate, looking for the right drug, which it is, then looking for the concentration. So 50 milligrams per milliliter, but I'm going to be giving 40 milligrams. I'm going to be giving it IM, and I will be giving this in the same syringe, which I checked is compatible. So that's right dose, right route, right time. So it's also a PRN medication. I'm giving it because of the possibility of morphine giving or kind of causing nausea, as well as he may also be feeling nauseous, which I'm not fully sure, it doesn't say. But even just that nausea prophylaxis. So that's the reason. The time is now because it's a PRN, and I'm giving it to Dennis York, and then the documentation I will be doing after. So now I have all of my items. I'm going to wash my hands. I'm going to be drawing up my medication here in a little bit, and because I'm doing it in the same syringe, I'm gonna do the diamond hydronate first and then the morphine. And just to verify here, I'm pulling up 0.3 milliliters of morphine and 0.8 milliliters of diamond hydronate. That does include more than mil, so I'm using the 3 ml syringe. Just gonna prepare my label here. So Dennis York. The medication is diamond hydronate. Milligrams, which is 0.8 milliliters, and morphine, 3 milligrams, which is 0.3 milliliters. So the total quantity is going to be 1.1 milliliter. The time is 11:10, December 10th, 2018. And 2. I will be wasting that after. So I'm going to be opening this, making sure that remains sterile. Making sure I don't touch the plunger, and attaching the filter needle to the syringe. I'm using a filter needle because I'm using an ampule, and there is that chance of having some glass in it. So once I have that open, I'm going to draw up my 0.8 milliliters of diamond hydronate. So first I'm going to be cleaning the top of this because it is a multi-use vial. And I'll be doing this for about 30 seconds, getting into the creases, and then letting it dry. I'm going to be injecting air into this syringe because it's a vial. Otherwise I won't be able to get the medication out. So I'll be injecting 0.8, 6, 7, 8, 5, 6, 7, 8. Yeah, I will inject 8 milliliters, or 0.8, sorry. It's 0.8. And now I'm going to draw that up. trying to get no bubbles. Probably will get a few. So that's point 1, 2, 3, 9. I'm just going to drop a bit more because I have some bubbles. And then using my pen, kind of pushing them to the top. And this way I don't have to re-clean the multi-use file, just keeping it in the vial like this. And then making sure I have the right dose. So I have 0.5, 0.6, 0.7, 0.8 of the diamond hydrogenate, which is the 40 milligrams. And I'm done with that. Just going to double check there's no air. Just going to recap this needle, which I can do because it hasn't gone into any person. Now there is medication in the top here, so I do want to empty that out. Okay, so now that it's empty, okay, so I'm going to be drawing up 0.3 milliliter. That goes right into the sharps container. And this I want to do really slowly because now that I'm mixing the medication, I don't want to have any bubbles. So I'm going to be doing that really slowly. There's one now. The 1.1 mil mark. Alright. I'm going to waste that at the end with Jocelyn, just checking if I have any bubbles. And I'm going to pull back to pull all of that medication out of the filter needle. I'm going to discard of that because I'm done, and I'll attach my injection needle, which is a 25 gauge 1-inch needle. This person is 12, so it's kind of on the line, but he can't, yeah, he could either get a 1-inch to a 1.5 depending on where you look at the ranges. And now I'm going to prime this needle. So taking off the cap just so I can see the blood come up. Looking for any bubbles, which I don't see, and just looking. Until I see the blood. Okay, which I see. Alright, so once I get the bleb on top of the needle, I know it's primed. I'm going to recap it for now until I take it into the room. I'm going to apply my label, and I'm just going to do my second check now. I'm going to do it on the syringe. Okay, so I have my syringe prepared. This is all my garbage, and I'm going to do another check to the MAR. So having my medications here with my calculations, I'm giving morphine 3 milligrams, which is 0.3 milliliters. Morphine's the right drug. 3 milligrams is the right dose. The right route is IM, so this is the syringe. The right reason, it's because he's in pain. The right time is a PRN medication, but he's in pain, so we're going to give it now. The right patient is Dennis York, and I'm going to document. So when I'm done, I'm just going to put a dot here that I've done my second check. And then diamond hydrogenate, so that's the right drug, 40 milligrams, right dose, IM, and it's the right time because it's a PRN for nausea, so right reason. And he hasn't gotten it in the last 4 hours for morphine or 6 hours for diamond hydrogenate. The right patient, Dennis York, and I'm going to document afterwards, but I'm going to put my second dot here. that I've done my second check. Now I'm going to bring the MAR into the room with that and my gauze. I'm going to wash my hands and put on my gloves. Oh, my gloves are here. They are. Okay, we're just going to turn this. There we go. Putting on my gloves. All right. I'm going to have my alcohol swab. Perfect. And the MAR. So, introduce myself again. I'm going to do my patient identification again, so comparing to the MAR. Can you just verify your name and birth date, please? And I'm going to get him to say that, and just comparing those two to make sure it's the right patient. I am then going to do my third check, so I'm going to have my medication here with my label, doing right patient, Dennis York, right drug, morphine, right dose, 3 milligrams, right route, IM, right time, it's PRN, but I'm giving it now because he's in pain, which is the right reason. And then I'm going to do the documentation at the end. And then the same for dimenhydrinate. Dimenhydrinate is the right drug, 40 milligrams is the right dose, IM is the right route, the time is now, and I'm giving it PRN. And the reason would be nausea prophylaxis, and if he has any nausea present right now. I will right now, I'm just going to talk about landmarking, just because for this patient there's 3 options. Well, there's actually 2, because I'm not going to be able to do it in a deltoid since it's more than 1 mil, and for this age you actually can't give more than 1 mil in a deltoid. The way that I would landmark this though, if I were to be doing it, I would find the acromion process at the top of the shoulder, and for a 12-year-old I'm marking 2 fingers down from that and injecting right below my finger in the center of the deltoid. For an adult this would be 3 fingers, but because this is a child it'd be 2. Then the other ones that I can landmark, I'm just going to move this over here for now. I'm just going to lift this up there, Dennis. So I can landmark the vastus lateralis.
It's been 30 minutes, just keeping timing in mind.
Finding the top of the trochanter and the bottom, and then I will be injecting to the vastus lateralis on the side of the thigh. And the other option would be, this would not be done on this patient. I'm just going to provide some privacy. Just can't. I wouldn't roll this patient right now because he's got a pain right here, but if this wasn't the patient, I would be moving him to the side. And this is, this is called the ventral gluteal. So I'm finding the greater trochanter with this top of heel of my hand, thumb pointing to the groin, my middle finger finding the iliac crest, and this finger finding where the iliac crest, my pointer, where the iliac crest turns down. Then I will be injecting in that little triangle where it's soft. I'm going to choose to do the vastus lateralis on this client because it is the right volume, and I don't want to be turning him on his side if he's got pain where his appendix was taken out. I'm just going to turn the camera and do the injection on the Crafty pad now. Making sure that can be seen. Yeah. So once I've landmarked, I'm going to clean that area with an alcohol swab going from the center out and letting that dry completely. At this time, I'm going to just open this gauze so it's ready in case there's any bleeding, and just making sure that this is dried. All right. So once it's dry, I'm going to take that off my needle and I will discard that. I'm going to do a Z-track for the IM injection to make sure that the medication stays in. So that's going to be pulling the sub-Q tissue over to the side with my non-dominant hand. I'll be doing the injection with a 90-degree angle straight in, and then just supporting it while still holding the Z-track with my non-dominant hand while I slowly inject the medication. Once it is injected fully, I'm going to wait 10 seconds, counting out loud, and once I've done that, I will pull out. First thing I'm going to do is cap my needle on the side and discard that in there. Then quickly, next thing is just holding that little bit of gauze. If it's appropriate, I would ask the patient to hold this for me. If not, I would keep holding it. Then I would make sure he's comfortable, ask him if he needs anything else, and go out and do my documentation. First, washing my hands.